We are talking about the nose, the nasal cavity, and the paranasal sinuses. The nose is this part that you can see, the out part here. When you look at the nose, it has got the septum separating the two nostrils, and then you have got the tip of the nose, and then you have got the ala, like the external lateral aspect, and then you have got a roof where it is connected up there. Okay, so when you look at the nose again, it has got openings. It has got this opening on the outside, which we call the external or anterior nares. They are also known as the nostrils, and these are the ones that will lead to the inside, which is the nasal cavity. External anterior nares or the nostrils. And when you look again on the about the nose, it is formed of two parts. It is formed of bone and also formed of cartilage, specifically hyaline cartilage. Well, the nasal cavity is going to extend from the nostrils or the external nares, going all the way to the back, where we're going to find the posterior nares. The posterior nares is also known as the cone or coane. You'll be able to see it because inside. We have divided the nose into two using the nasal septum. So I've got two parts, and each one of these nasal cavities have got a roof, a floor, the medial wall, which is the septum, and the lateral wall. So this is the inside. You can see this is the anterior nares, also known as the external nares or the nostril. And then behind you have got a posterior nares, also known as coane here. And then you also have these structures that you can see. This is going to be on the medial wall or the septum of the nose. You can see the septum, you have got the these structures. Now for now, let me not mention much about them. But look, when you take a cross section of the, because this is the through the very middle. On top here, you have got an hair sinus which is present in the frontal bone. We call it the frontal hair sinus. And then you have got the sphenoid bone here. You have got the sphenoidal hair sinus. On the bottom of the nose, you have got the hard palate separating the nasal cavity from the oral cavity. So when you look at the cavity itself, remember I said that you are going to have the roof, the floor, the medial and the lateral wall. The roof is basically the top. Okay, a roof is top, isn't it? So when you look at what forms the roof, starting from behind going to the front, you have got this bone which contains these sinuses. That's the sphenoid bone, specifically the body of the sphenoid. Because you have got the wings, the greater wing, the lesser wings, but it's a body of the sphenoid. After the sphenoid, you are going to have this bone where cranial nerve number 1 passes. We call it the cribriform plate. This is part of the ethmoid bone. And then going forward, you have got this part. This is a frontal bone. And then going in to the front now, you are going to have this bone face, which is the nasal bone. And then very much in front, you are going to have cartilage, the hyaline cartilage. These are the bones that make up the nasal cavity from posterior to lateral and the cartilage. When you look at the floor is the bottom. It separates the nasal cavity from the oral cavity and is formed by the hard palate, okay, or the bony palate, because you also have the soft palate at the end here where you find the uvula. But this is the hard palate. The medial wall, also known as the nasal septum, has got the osteocartilaginous. It is actually an osteocartilaginous partition. What do we mean? It has got a bony part, osteo, and then it has got the cartilaginous part or the cartilage, that is the medial wall. And then what forms up the medial wall? You have got the perpendicular plate of the ethmoid bone. Remember, the ethmoid bone, we have got on top here the cribriform plate of the ethmoid. This is known as the perpendicular plate, like it's perpendicular. Okay, and then number two there is the bone which you call the vomer, and then number three is now the cartilage, septocartilage. So these are the three structures that will form up the septum. When you look at now the lateral wall of the nose, this is now what is very important. The lateral wall will show three horizontal bony projections, which we call the concha or concha. And these concha, they are just there to increase the surface area of the nasal cavity. You can see on top, you have got what we call the superior nasal concha, the middle nasal concha, and then this one down, which we call the inferior nasal concha. Below each one of these concha, you have got a cavity which we call a meatus. So below the superior nasal concha, we are going to have the superior meatus. Below the middle nasal concha, we have got middle meatus. And then below the inferior nasal concha, we have got the inferior meatus. All right. So that is it. But again, on top of the superior nasal concha, we have got another small opening or meatus, which we call the sphenoethmoidal recess. So that's a small space above the superior concha and below the roof. That's a sphenoethmoidal recess. It's very important for you to take note of that. So this recess and the meatus, which we call meaty if they are a lot, will receive openings of paranasal sinuses and the nasolacrimal duct. Make sure that you take note of that. And please, concha is not the same as coane. Coane is this uh, posterior nair. Concha are these elevations. Take note that the sphenoethmoidal recess and the meatus, superior, middle, and inferior, they are going to receive openings of paranasal sinuses. When you look at the nasal cavity, it has got a mucosa. Mucosa is basically connective tissue, tissue, right? The soft, so like when you look at the mouth, because it has surrounded by epithelium. So the nasal mucosa has got olfactory and respiratory mucosa. Okay, we have got the olfactory and respiratory mucosa. Remember, the nasal cavity is responsible for smelling. You have got the olfactory nerve there, but you also have the respiratory part. So the olfactory mucosa is related to the sense of smell, and it contains this delicate olfactory nerve. It's delicate actually and contains olfactory nerve cells. It is present in the upper part of the nasal cavity in the roof. One you can see in blue there. So on the lateral wall, it lines the upper surface of the superior concha and the sphenoethmoidal recess. That is where on the lateral wall, the upper part of the superior concha and the sphenoethmoidal recess. On the medial part, this is the medial part, it is going to line the superior part of the nasal septum. Just the superior part of the nasal septum. That's the olfactory mucosa. You also have the respiratory mucosa, which is lining. This one now lines the rest of the nasal cavity, and it is thick, ciliated, highly vascular, and contains mucus. So it has got goblet and it has got glands and goblet cells. So it will be able to line the lower part of the nasal cavity. And the function of the respiratory mucosa is to moisten, to clean, and to warm the inspired air. The air is going to be moistened by the secretion of numerous serous glands. It is going to be cleaned by the removal of dust particles by the ciliary action of the columnar sedated epithelium. and then the air is going to be warmed by a submucous venous plexus because you have got like good blood supply there. So the vestibule is lined by skin. It's the only part of the nasal cavity that is lined by skin and not by mucosa. The vestibule is this part that is outside. Okay, the vestibule is this part that's outside. The rest of the nasal cavity is lined by mucosa, but this one is lined by skin. What's the epithelium then? It's going to be stratified, squamous, keratinized. So what is the nerve supply to the nasal cavity? The olfactory mucosa is supplied by olfactory nerve. That's for spatial sensation, cranial nerve number 1. And then the nerves of general sensation will come from number 1, you have got the ophthalmic nerve and the maxillary, which are coming from the trigeminal. You also have the anterior ethmoidal nerve, the autonomic fibers, and then you have got this the palatine branches of the pterygopalatine ganglion. So I've got what we call the pterygopalatine ganglion, which will give the nasal branches, the nasopalatine branches, and then the palatine branches. So these are the nerves that you can see here. You can see the olfactory nerve, which is cranial nerve number 1, and then you have got the anterior ethmoidal nerve here, going all the way to the front. Okay, and then you have got the posterior superior lateral nasal nerves. These ones you have got the posterior inferior lateral because they're on the lateral aspect. So you have got posterior, they're at the back, posterior but superior, and this one is posterior but is inferior. And then you have got the nasal branches of the anterior superior alveolar. The alveolar guys are related to the teeth, so they are related to the upper teeth. So anterior because in front, superior alveolar. And then you have got the nasal branches of the infraorbital nerve. You have got that nerve that passes through the infraorbital foramen, if you remember. And then you have got this, the nasopalatine. You can see this is on the medial aspect, the nasopalatine nerve. And then you have got the septal branch of the anterior ethmoidal. Anterior ethmoidal is giving this branch that is going to the septum. So the arterial supply of the nasal cavity, this is important for you to know, guys, very, very important. So I've got the maxillary nerve, the facial nerve, and the ophthalmic, not nerves, artery, sorry. Maxillary artery, the facial artery, and the ophthalmic artery. So a branch of the maxillary, you have got the sphenopalatine artery. The facial nerve, you have got the superior labial, and then the ophthalmic, you have got ethmoid artery. Maxillary and facial arteries are branches of the external carotid. So don't worry much about this. It's as simple as this. Look at how it goes. I can start for you so that you pick it up from the aorta. So from the aorta, you are going to have the ascending aorta, then the arc of the aorta. From the arc of the aorta, I've got the brachiocephalic trunk, you have got the common carotid, okay, the left common carotid, and then you are going to have the left subclavian. This carotid, the common carotid, is going to bifurcate into the external carotid and the internal carotid. The internal carotid is now going to give you the ophthalmic artery. Ophthalmic artery is going to divide into the anterior ethmoidal and the posterior ethmoidal. You can see these ones. The anterior ethmoidal is supplying the anterior aspect of the nasal cavity, the posterior ethmoidal a bit back. The external carotid, on the other hand, is going to give you the facial nerve artery and the maxillary artery. The facial artery is going to give you what we call a branch of the facial artery. This is the nasal branch, okay, coming from the facial artery. And then the maxillary artery is going to give you the sphenopalatine artery, which will give you now a branch that will also go. So the sphenopalatine artery. The same maxillary artery will also give you the lesser palatine artery and the greater palatine artery. So how many nerves can you see here? You have got a branch of the facial nerve 1, greater palatine artery 2, lesser palatine artery 3, a branch of the sphenopalatine 4. You have got the posterior ethmoid and the anterior ethmoid 5 and 6. So you have got these 6 arteries, okay, coming here. But the major ones that we mentioned, you have got the superior labial artery, or the superior labial artery or the septal branch is coming from the facial nerve. And then you have got the greater palatine artery, Okay, so here we just didn't include the lesser palatine. So the lesser palatine is not going to the nasal cavity. It's, you can see it's turning back like this. So greater palatine coming from where? From the maxillary artery. And then you have got the sphenopalatine artery. Where is it coming from? The sphenopalatine also from the maxillary. Anterior ethmoidal and posterior ethmoidal. So you need to know these five branches. And then they are supplying this area. They are all meeting on this area, and we call it the Little's area, also known as the Kisselbosch plexus. Now, this area is very important because it's prone to bleeds. Like when you are in the sun, it is prone to bleed. Or if you are hit there, you'll be bleeding. And that bleeding through the nose is known as the epistaxis. Epistaxis. Okay, so that is very important for you to understand. Is there any question? Are we okay? Yes. The lesser palatine is also coming from the maxillary, but it's just that this one is not part of those arteries that will supply the nasal cavity. Okay, so they did. Okay, so for the maxillary artery is a very big artery. So we are going to discuss it as a topic. We'll talk about all the branches of the maxillary artery from the first, third, and first, second, and third, and then we'll be able to pick it from there. So we are going to discuss the maxillary artery, and then we'll be able to pick it from there, right? But for here, you don't need to know that much detail. Just need to know that you have got this branch, the greater palatine. There's actually a mnemonic that you'll be able to use to know all the branches of the maxillary and which part they are from. And then the venous drainage of the nasal cavity, you have got the facial vein, ophthalmic vein, and then sphenopalatine vein. The lymphatic drainage, the vestibule is going to, like the lymphatic, the vestibule, which is this outside part, will drain into the submandibular lymph nodes. The rest of the nasal cavity will drain in the upper cervical, upper deep cervical lymph nodes. Okay, the rest of the nasal cavity. So again, this is the drainage. So we're going to have the nasal vein, which will go into the foramen cecum, and then you are going to have the drainage to the cavernous sinus. We understand about the cavernous sinus later on, and then the drainage to the facial vein, and then the drainage to the pterygoid plexus in the infraorbital. So the paranasal sinuses we are talking about, paranasal sinuses, these are just spaces that are filled with air. They are found in the ethmoid bone, the sphenoid bone, the frontal bone, and also the maxilla. They are lined by respiratory mucosa, which is continuous with the mucosa of the nasal cavity. And these would drain into the nasal cavity. The paranasal sinuses drain into the nasal cavity. Okay. The function of the paranasal sinus is to keep the weight of the skull light, because if the skull was on a bone, it would be so heavy, and also act as a resonant chamber for speech. For you to be able to speak well, it's because you have got these spaces giving resonance, and also for air conditioning. The respiratory mucosa lining helps in warming, cleaning, and moistening the incoming air. So these are the sinuses that you can, the paranasal sinuses. You have got in the frontal bone, the frontal air sinuses, the ethmoid bone, the ethmoidal air sinuses. Now the ethmoidal air sinuses, you have got the anterior, the middle, and the posterior. So you need to know that. And then in the maxilla, you have got the maxillary air sinuses, and then you have got also in the sphenoid, the sphenoidal air sinus. So how do these drain? So when you look at the, let's start with this guy, the sphenoidal. You can see this boy behind here. The sphenoidal sinus will drain into the sphenoethmoidal recess, which is that space that is just on top of the superior concha. And then when you look again, okay, when you look at the posterior ethmoid, remember the ethmoidal sinuses? We said that you have got posterior, middle, and anterior. The posterior ethmoidal will drain into the superior meatus. Okay, the posterior ethmoidal in the superior meatus. The superior meatus is just below the superior concha. And then the middle ethmoidal, anterior ethmoidal, maxillary, and frontal sinuses will drain into the middle meatus. So majority of them will drain into the middle meatus. The inferior meatus, the only thing that drains there is known as the nasolacrimal duct, which carries tears. That's why if someone is crying, they are they are going to have a running nose. Why is it like that? Because the tears are actually going to be drained medially. They are going to go into the middle aspect of the eye, and then via the lacrimal sac, and then they are going to go into the nasal cavity. That's why when someone is crying, they're going to have a running nose. Okay, this again is a nice picture showing you these openings. So the sphenoidal air sinuses behind you open in the sphenoethmoidal recess, and then the posterior ethmoidal air sinus, the posterior ethmoidal drains into the superior meatus, and then the nasolacrimal duct is the one opening in the inferior meatus. Now, when you look at the middle meatus, you have got a lot of things that are opening there, but in the middle meatus specifically, you have got some areas there. So in the middle meatus, you have got what we call the bulla ethmoidalis. That's where the middle ethmoidal sinus will drain in the bulla ethmoidalis. That is a bit posterior in the middle meatus. And then we have got what we call the hiatus semilunalis or the semilunalis hiatus. That's where the maxillary sinus, the anterior ethmoidal, and the frontal sinus will be able to drain. So in the middle meatus, it's only the middle ethmoidal that drains in the bulla ethmoidalis. The rest will drain in the hiatus semilunalis. So that is basically about the nasal cavity. I'm not going to talk about the pharynx. We'll discuss that in a later class. Okay. So that is it. You can try out some questions. Which of the following is a component of the roof of the nasal cavity? So I'm also going to send for you some questions about the practical test that they can ask you about the nasal cavity. Okay, so here we end. Thank you so much.